I am Dr. Sun. I'm from Peking University, 3rd Hospital. My hospital is located in the north part of the city of Center, which is about 25 kilometers away from Beijing Capital International Airport. My hospital has the biggest spine center in north part of China. Today, I'm going to talk about the reconstruction after the correction of severe cervical kyphosis, the application of customized 3D printed vertebral body. Severe cervical kyphosis is identified generally like local kyphotic angle more than 40 degrees. The consequences of severe cervical kyphosis can be severe, including the change of biomechanics, accelerated degeneration of adjacent segments, hyperlordosis of lumbar spine, and most severe is the spinal cord compression. For the treatment strategies of severe cervical kyphosis is to decompress spinal cord compression by the proper and adequate correction of kyphosis. The first step of treatment is pre-surgical correction by means of traction. The purpose of traction is to extending the anterior column and shortening the posterior column, and that will make a surgical treatment easier. The occipital-mandibular traction is the most common method we used, but it has the shortage of limited force, hard to tolerate, and ensure effect, so it has been used less and less. Continuous contraction is the most popular method used during the practice, but it also has the shortage of painful, difficult to nurse, and is definitely not suitable for the kids. Since 2006, we created a new method of traction. It's called balanced suspended traction. It has an advantage of non-invasive, no hurt, and more freedom for the patient. Patient can be off traction during the daytime for dining and toileting and bathing, and during the night, he can be off traction for good sleep. Suspended traction can also be used with OM traction or skull traction as a combination. Once the kyphosis has been partially corrected by the traction, we are in step 2 of treatment, surgical correction. If patient has a minimal collapse of vertebral body, we can just use anterior discectomy and fusion on the plate to correct the kyphosis. This is idiopathic cervical spine kyphosis with the kyphotic angle more than 60 degrees. We put him on the suspended traction for 1 week. Then he received 3 levels ACDF. The kyphosis has dramatically reduced. This 12-year-old girl had an idiopathic cervical spine kyphosis. The cup angle is more than 77 degrees. She received combined traction for almost 2 weeks. On the day 13 of traction, the kyphotic angle is only about 7 degrees. She received 3 levels ACDF, and the cervical lordosis has been restored after the operation. At 1 year after the operation, her neurological function returned to normal, cervical lordosis remained, and the spinal cord compression was thoroughly relieved. In some patients, the kyphosis cannot be partially corrected by the traction, so we have to give them anterior, posterior, anterior procedures, and this can be done in 1 stage or 2 stages. This patient suffered from post-laminectomy kyphosis. The cup angle is nearly 60 degrees. He received combined traction for 6 days. The cup angle improved about 30%. So he received posterior release and osteotomy, a multi-level ACDF, and the posterior fixation and fusion. After operation, the kyphosis was dramatically corrected and the neurological function obviously improved. This 5-year-old little boy had uneven steps and left hand weakness for half a year. The cup angle was near 100 degrees. He received a combined traction for 1 week. The kyphosis was dramatically corrected. Because his anterior column is too small to bear any implant, so we have to perform the posterior release and correction and fixation only. 5 years after operation, he returned for review with normal neurological function and no hardware failure on the cervical spine. Some patients, their kyphosis has been partially corrected by the traction, but they had very severe collapse of vertebral body. So in that situation, then we have to perform a correctomy. This little girl suffered from osteochondrodysplasia, and her cup angle was 70 degrees, but she had skull traction for 2 weeks with minimal improvement of cervical kyphosis. So we put her on a suspended traction for 1 week. The cervical kyphosis obviously improved. She received C3 corpectomy with the implantation of a titanium mesh, but 1 year after surgery, she returned and we found the mesh subsidence happened. Fortunately, the neurological function remained normal. This is another example of severe cervical kyphosis, and he had previous ACDF. He received combined traction. The cup angle was dramatically improved. Then afterwards, he received posterior osteotomy, multi-level corpectomy, and posterior reconstruction for the final correction of cervical kyphosis. His neurological function improved after operation, but from X-ray, and we found the titanium mesh didn't fit the end plate very well. During past 10 years, the application of 3D printed metal implantation in orthopedics has been developed very well. Now it is a mature and stable technology, and also it has a larger surface, smaller intensity of pressure, with satisfied bone ingrowth. In 2014, the world's first case of 3D printed customized artificial cervical vertebral implantation was performed in our hospital. This patient had a cerebral palsy with severe cervical spine kyphosis. He received suspended traction. Now afterwards, we performed the anterior-posterior approach and 3D printed artificial vertebral body implantation. 8 months after operation, and we can see the fusion has been solid. This patient had a severe congenital cervical kyphosis and also combined with the postlaminic kyphosis due to intramedullary tumor. After receiving the suspended traction, a combined anterior-posterior approach was performed with 3D printed artificial vertebral body implantation. This 3D printed metal artificial vertebral body has the advantage of minimal request or even no need for bone graft. It can be used as a reconstruction of 1 or 2 vertebral bodies. But this 3D printed metal artificial vertebral body has some shortage, like poor self-stability. The longer implant, the worse stability. Sometimes the implant displacement and subsidence happened, especially in longer implant. This 79-year-old gentleman suffered from CSF and severe degenerative cervical kyphosis. He received hybrid surgery with corpectomy and ACDF, but 3 months after the operation, he returned with a neurological deterioration. From the X-ray, we find the subsidence of 3D printed artificial vertebral body with the filler of the plate. For the purpose of the revision surgery, we designed a new implant with a self-stable customized implant with a screw fixation into the vertebral body. His neurological function improved after the surgery, and no hardware failure after the operation. This 40-year-old gentleman suffered from tuberculosis of cervical spine. At the beginning, he only had neck pain, but after the massage, he developed incomplete quadriplasia. After 2 weeks skull traction, the cup angle was only 16 degrees. So we made a surgical plan. So after the skull traction, a multi-level ACDF will be performed with a self-stable customized implant with a screw fixation into the vertebral body will be performed, and also with a posterior instrumentation. But we found a problem with this kind of implant. The implant may shift backwards during the screwing into the vertebral body. So we designed a new implant with a self-stable customized implant with a screw fixation into the vertebral body and with a flange. Finally, he received a 3-level corpectomy with a self-stable customized implant with a screw fixation into vertebral body and a flange fixed into the vertebral body with a posterior C2 to T1 instrumentation. After operation, his neurological function improved, and the anterior column of cervical spine has been reconstructed. The 3D customized artificial vertebral body can also be used in other cervical spine disorders like OPLL. After the corpectomy, the implant was put into the gap. As the screw drive in, the vertebral body was pulled towards the implant to achieve a solid fixation. And also, as the screw drive in, the flange was pushed towards the vertebral body to achieve a solid fixation. In summarization, the 3D printed customized artificial vertebral body has the advantage of good adaptability, good stability, good radiological result. It can be used as the application of reconstruction in cervical kyphosis and other cervical spine disorders. Before I finish my talk, I would like to welcome all of you, my dear colleagues, to join our own society, Cervical Spine Research Society, Asia Pacific. The 12th annual meeting and the 2022 instructional course of Cervical Spine Research Society, Asia Pacific will be held in March 24 to 26, 2022 in Beijing. The new deadline for call for abstract is December 1st, 2021. Please visit our official website at www.csisap2022.cn. I hope the COVID-19 pandemic will be well controlled worldwide so we can have a chance to see each other in Beijing. Welcome to China. Thank you very much.